Welcome to the offices of the Global Tourism Resilience and Crisis Management Center at the University of West Indies Mona campus, with offices in Asia, the Middle East, and Africa. Established in 2018, the Resilience Center has as its primary objective safeguarding and protecting the global as well as the global tourism space, as well as to ensuring the sustainability of tourism globally. Today we are here to honor that goal with the announcement of a revolutionary and groundbreaking initiative aimed at providing traveler protection and emergency services, as well as to ensure the safety and protection of the persons working in the tourism space and by extension the citizens of the country. This initiative is called the Jamaica Cares Program. I'm your host, Lloyd Waller, the Executive Director of the Global Tourism Resilience and Crisis Management Center. Thank you for joining us on our various virtual protocols, which is now a norm. We have with us today several stakeholders who have helped to put this program together and who have helped to expand the program itself. And to take us through the program, I'd like to first introduce Mr. Dan Richards, the CEO of Global Rescue, our main partner. Mr. Richards?
Thank you, Dr. Waller. It's my privilege to discuss the new model our relationship has created to address the travel risk and crisis management challenges of the 21st century. It obviously includes the current COVID-19 crisis. What we have done is to build an end-to-end solution for travelers and tourists going to Jamaica to give them the peace of mind that they need to start traveling again. Because this is where everything starts, with people having the peace of mind to travel. We know the desire is there. It has been there for a long time. It has been building. But people need to feel confident that their safety and well-being is going to be taken care of during this current crisis and beyond. And that is exactly what the Jamaica Cares program is all about. The initiative is comprised of two major components. Number one, an all hazards program, and number two, a COVID-19 specific program. I'm going to run through what both components consist of here now. Both will consist of field rescue, emergency transport, advisory, and oversight services from the personnel at Global Rescue and our partners at the Johns Hopkins Emergency Medicine Division of Special Operations and Elite Medical Group. Arrangements with Jamaican hospitals are being established for provision of local care. Medical and security evacuation will be provided to those in need of higher levels of care, and consulting and bedside advocacy services for those who need them. Additionally, the All Hazards program will include evacuation, logistics, and response for all tourists in need of medical and crisis support for their emergencies, big and small, up to and including mass crisis support for large events like natural disasters, terrorism, and other significant systemic type crises. The COVID-19 services specifically will include rapid testing and triage for symptomatic travelers, treatment and associated care as needed in Jamaica that includes up to $50,000 of medical insurance coverage, access to Global Rescue personnel in Jamaica to ensure an immediate response, and up to $100,000 of international medical coverage to include medical costs that are incurred during travel home, repatriation, and evacuation operations. To support the program, Jamaica Cares will charge a mandatory fee to all non-Jamaican passport holders, currently estimated at about $40. That fee will support the stand-up of our Jamaica Operations Center. The JOC, as it's called, will be based in Montego Bay with additional expansion to other locations as necessary, and will have the capacity to employ up to 80 medical crisis and response personnel, which will also serve as a job creation mechanism in Jamaica as we come together to deal with this terrible COVID-19 crisis. The JOC will ensure a rapid, boots on the ground response capability for dealing with crises when they occur, including coordinating our COVID-19 response in Jamaica in the region. We envision headcount to grow as we roll out the program to Jamaica and ultimately throughout the region and potentially the world. I want to commend Minister Bartlett, Dr. Waller, and the country of Jamaica for the innovative vision to put this unique program in place. I'd also like to thank Gloria Guevara and the World Travel and Tourism Council for organizing and supporting the global response of the travel and tourism industry to the pandemic, and Lori Myers at the Global Resiliency Council and Dr. Talib Rafai for their important support. I assure you the personnel of Global Rescue stand ready, willing, and able to execute. We will not rest and we will not stop until we have accomplished our mission. That mission being the restoration of Jamaican travel and tourism to pre-COVID-19 levels and ongoing support thereafter. So thank you very much for this opportunity. Gloria, over to you.
Good morning, can you hear me okay?
Yeah.
Excellent, thank you, Dan. Delighted to be here. And as you say before, first of all, let me congratulate also the GTRCMC, which is the Global Tourism Resilience Center and Managing Crisis co-chairs. And greetings to my friend Edmund Bartlett, the Minister of Jamaica, for his amazing leadership as well. Dr. Taleb Rifai, a great friend also. Happy to see you and thank you for your leadership as well. Executive Director, Professor Waller, also for the amazing support. Congratulations to the Resilient Council, very especially to Global Rescue and Richards, one of our members who has been very instrumental in helping us to define the strategy at WTTC, and the several members also that are joining us today and distinguished guests. We believe at WTTC that collaboration is key to accelerate the recovery and is critical to restore consumer confidence. So this initiative is a perfect example of the type of collaboration that we need to restore the confidence of the travelers and help us to bring back millions of jobs. As WTTC, we have estimated so far, as you know, that 121 million jobs have been impacted. And by the end of the year, that number seems that it's going to be 197. And it is crucial to resume international travel. So we see this as a very important initiative that would help us a good example around the world that hopefully will be replicated by other countries. Per the request of Saudi Arabia, recently WTTC proposed a plan to recover 100 million jobs and to resume international travel. That plan has 12 commitments from the private sector, where this is a great example of things that can be done. But one of the points also is that we need to have a global, robust, fast and cost-effective testing and tracing program, which is key for the recovery. International global cooperation is very important and is in order to be effective in this recovery, we need to continue with that. It is crucial in our mind that we need to remove the quarantines. We need to remove all the travel barriers so that people can freely move around. The evidence tells us that the travelers that they want to travel, but they don't want to be stuck in a country with quarantines or with travel barriers. So that's why this plan is very important to resume international travel. And the announcement today is making history in our mind. From WTTC, we believe that we have to learn to coexist with this virus. And we cannot wait for a vaccine to be ready or be totally deployed around the world in order to resume international travel. It is crucial that we learn from the past. And we, as I say before, can travel and do this in a protective way, saving lives, but at the same time, we restore and bring back the millions of livelihoods impacted. At WTTC, we work with our members in multiple countries to define our safety travel protocols that are helping us to restore confidence. Jamaica was one of those countries that received that recognition. And currently, more than 120 countries or destinations around the world have received this important stamp. That is just one step also ahead in the same direction. So the travelers can recognize the destinations that have implemented the protocols, which complement the initiative that it was announced today at the same time. Again, a great example of collaboration. So finally, let me congratulate once again the government of Jamaica, Minister Bartlett and Richards, and everyone involved in this initiative, because this is a step in the right direction that we're really truly hoping that other countries will follow, so that we can continue rebuilding trust from the travelers and moving in accelerated recovery. Thank you for the invitation and all the success.
Thank you so much, Gloria. I think it's my turn to say a few words here. I'm very proud to be part of the two organizations that are organizing this, the Center and the Council in London. As far as the center is concerned, I want to congratulate Mr. Bartlett, of course, and Professor Lloyd, yourself, and everybody that's involved in the council and the center as well. This is a very great initiative. We've been talking about this for a long period of time, but to do it, to materialize it between the private and the public sector, has been a very, very important step to make. Now, why is this important? It's important because security is important. Peace of mind is important for travelers. Travelers will not take upon themselves the trouble of traveling if they don't feel secure, if they don't feel 100% confident about what they're doing. I read the program very, very well, and it goes into details. And I want to congratulate all the parties here, including the insurance companies that are here. I want to say this and say that now it's in the hands of governments and in your hands, Gloria. You've been playing a very important role, bringing all the governments together, filling a vacuum that has been existing for a while. No international system is operating yet. This concept must become international, and we must have most governments adhere to it. That's the only way that we could travel safely and have a peace of mind. I thank you all very, very much. Thank you so much. Mr. Lloyd, I turn it back to you now. Thank you.
Okay. So thank you, Talib Rafai, Dr. former Secretary General of the United Nations World Tourism Organization, and my co-chair of the Global Tourism Resilience and Crisis Management Center, as well as the Global Travel and Tourism Resilience Council. My friend Gloria Guevara, President of the World Travel and Tourism Council, Daniel Richards, the CEO of Global Rescue, who I met 3 years ago in London, and we began that discussion, which has culminated in this announcement today. Or my own executive director of the GTRCMC, Professor Lloyd Waller, and a partner who is off camera but is very much present, Wilfred Bagaloo, who is the chairman of the Tourism Recovery Task Force here in Jamaica, and who has been very instrumental in putting the nuts and bolts together to enable the finalization of this groundbreaking world-class initiative, first of its kind anywhere on planet Earth. And Wilfred comes to us as a partner from Price Waterhouse, and I must really thank him for not just his energy and his assiduity to purpose, but certainly the intellectual rigor that he's brought to the whole process, and the abilities that he's shown of working with people and pulling ideas and practices and policies together to create outcomes that are world-class. Congratulations and thank you very much, Wilfred Bagaloo. Our specially invited guests, all members of the media. This is a particular welcome to the TRC that is so important, as it is a welcome from me as Minister of Tourism in Jamaica. And I want to thank you all for joining us as we make this very pivotal announcement for Jamaica's tourism. But before I provide that information, let me put what we're doing into context. Last year, tourism made up 10% of global GDP with almost $9 trillion. After 10 months of one of the most geographically dispersed and consequential pandemics in recent history, COVID-19 has changed the world and the tourism industry as we know it. The deadly virus has already spread to the four corners of the earth with a death toll of over 1 million. The rapid spread of this virus continues to confound efforts by global leaders to contain it, resulting in heightened panic and fear across the globe. As it relates to tourism, international arrivals are projected to see a 60 to 80% downturn, with 120 million jobs at risk. In fact, a McKinsey report forecasted a cumulative drop of some $3 to $8 trillion before tourism expenditure returns to its pre-COVID levels in 2024. Also, the International Monetary Fund late last week said the impact of COVID-19 on the Caribbean has been massive, particularly for tourism-dependent countries like Jamaica. Despite these negative forecasts, what we have learned is that with crisis comes innovation and opportunities to better manage, plan, and recover. This is why we are taking steps to speed up our recovery for both the tourism industry and the economic sector. Consumers are trepidatious given the uncertainty of the times we live in. This new demographic of travelers, Generation C, as we have called them here in Jamaica and have given that term of this new demographic to the world, also requires much more in terms of safety and security of destination. Indeed, destination assurance is becoming a critical precondition for travel today. COVID-19 has not only demolished our projections, but has forced us to coin new ways to operate and ultimately build experiences. As thought leaders, Jamaica is proactively taking a vital role in recovering and rebuilding the spirit of travel by restoring the trust and confidence of travelers in our destination. Travelers do what they can to feel safe, and destinations must make meaningful contribution towards that end too. Trust has to be earned. We can only do that with action, not just words, through innovation, partnership, and empathy. Today is tangible evidence of Jamaica and the Global Tourism Resilience Crisis Management Center's resolve to ensure resilience in this new COVID endemic world. In times of crisis, we see innovation, new procedures like the COVID-19 protocols, resilient corridors like Jamaica has led the world in establishing, air bubbles, and yes, our new protection program, which brought us here today, Jamaica Cares. Implementation of the coronavirus resilient corridor is an important and effective component that gives us the ability to manage and track the movement of tourists while enabling visitors to embrace all activities within that area. Thankfully, Jamaica has since welcomed 150,000 visitors since our reopening in June 15. And through the protocols aligned with the resilient corridor, we have not had an incident of infection, nor have we had any worker of the industry being infected. Jamaica Cares represents another prong in our COVID resilience and has been designed very specifically and very deliberately. The program protocol will ensure our ability to welcome travelers to Jamaica safely, knowing that in the worst case scenario, they will be treated to the gold standards of care and service. By building an alliance that looks at the travel experience from home to Jamaica and back home again, Jamaica is being the first to offer this end-to-end health logistics coverage. If an unexpected medical emergency occurs, this program has identified precisely the components that ensure the best possible outcome for the traveler. And I think you heard it very eloquently and clearly stated by Dan Richards in his opening comments. By requiring traveler protection and service to all visitors equally, they will gain confidence by knowing that they are better protected. And so is everyone else traveling into Jamaica. They all have the same protection, and that protection is also given to our own Jamaicans. There is security, I am sure and positive, in the collective unity of the Jamaica Cares program. Everyone can see tangible outcome from the value and resource investment of the program, from the operation center being built in our country to the local jobs that will be generated and training programs for our locals. As these resources are understood and implemented, We expect our destination will follow, and other destinations too will follow this new gold standard of care. It will become more prevalent, and the travel sector will benefit globally. Through preparations for the unexpected. And that's why the Global Tourism Resilience and Crisis Management Center was established by me. We mitigated fear and complement the travelers' efforts to stay safe. We, the travelers, the destination and local businesses all become partners, and our alliance has common goals. We want to protect travelers, protect the local health system, and at the same time open up travel with confidence. We look forward with anticipation to the implementation of Jamaica Cares next month, when by our own determination and indeed protocols established within statute, we will require every visitor coming to Jamaica with an international passport to have this kind of coverage to protect not just themselves, but our people in the destination. There are multiple rigorous steps that the partnerships and their terms are required to complete in order to serve our visitors. It's a high standard of excellence, and we intend to meet or exceed it. Thereafter, we have already begun speaking with other countries who wish to follow this standard, and we thanks for the comments from Gloria in that regard. Regionally and globally, we aim to build out our network and ensure the safety, security, and seamlessness of destination Jamaica. Thank you.
Thank you very much, Minister Bartlett and Chairman, and thank you very much, colleagues, for outlining the Jamaica Cares program, which is an exciting initiative which will certainly add value to the tourism space and fulfill the mandate of the Global Tourism Resilience and Crisis Management Center. I would now like to invite the media to ask questions, and we'll start with those persons on Zoom. Okay, so we've looked all right. Okay, well, fantastic. It's quite clear that everything we've done here is very clear, and therefore we don't need to provide any additional information. Just to say that we have prepared press kits, and they will be shared with the press within the next half an hour, certainly after this program, which will outline some additional components of the Jamaica Cares program, and we are also available for individual discussions about the Jamaica Cares program. Well, thank you very much, and we look forward to stating the specific date and time and the launch of the initiative itself. I'm Lloyd Waller from the Global Tourism Resilience and Crisis Management Center located here at the University of West Indies Mona campus. Thank you for taking the time out. Oh, we have a question. Okay, good. Okay, so Dan, I think this question is for you. The first question is being asked is this specific to any one geographic territory as it relates to the coverage, or is it for multiple regions?
I think you need to unmute. Professor Waller, you need to unmute.
Oh no, he's unmuted now. He
Okay.
can speak now.
Host needs to unmute.
You can tell him to talk.
Dan,
He's still muted. He's still muted.
Dan?
Oh,
Sorry, Dan?
Dan,
Can you hear me now?
Yeah, we can hear you now. Go ahead.
Yes, yes.
Okay, great. Thank you very much. No, the program will be available to all nationalities that are entering Jamaica with non-Jamaican passports. So everybody will be able to take advantage of the services and rely on the program to provide these essential services if and when they should need them.
Very much, Dan. All right, I think that's the only question we had. Okay, excellent. All right. Thank you very much, everyone, and thank you for taking some time out to come here today. Oh, fine. So there are some additional questions in the chat box. So every time I say thank you, I'm now getting questions. You have those questions in the chat box? I think that one is for you again, Dan. Oh, that's not for. Oh, so you, Minister. Okay,
No,
go ahead.
At the moment, there will be no requirement for UK visitors. The arrangements so far as our protocols are concerned in Jamaica are for certain designated countries that have shown high incidences of infection, and community spread. They did not include at the time the UK.
Thank you.
When does the program go into effect?
Minister, you want to take that one?
Well, we're expecting to have the program into effect before Thanksgiving. The specific date we're tidying up now with regards to certain local protocols here in Jamaica. But I'm intending to make an announcement with regards to that very soon. It's certainly within the next 2 weeks.
Please explain more on the $40 charge to each visitor to the program.
Dan, you want to take that one?
Sure, can you? Okay, good. So there will be a variety of travel risk and crisis management and response services available. Really an end-to-end solution. And it will start with advising and consultating services on the medical side for each individual and family who is traveling to Jamaica. For those who are symptomatic, it will also include access to rapid testing. So provision for the test and rapid results will be included. Will also include case management, and that may include bedside management and the management of all the logistics associated with getting the individuals not only tested, but also the care that they need in Jamaica at the hospitals that they might, and clinics that they might be getting care from. And then ultimately evacuation, transport, and repatriation, should it be needed, back to the individual's home country. Included in the program also are 2 insurance elements. One very important insurance element will cover medical expenses in the country of Jamaica. So medical expenses that are incurred at clinics and hospitals within Jamaica will be included in that cover, number one. Number two, if and when there is a transport or repatriation or evacuation that is needed, there will be up to $100,000 of coverage for that. So any care that is needed on the way back to the individual's country of origin will also be included. So it really is an end-to-end that includes advisory services, consulting services, testing, care, and then ultimately transport if all of that is needed. Hopefully, as Minister Bartlett said, the need for this will be low, and the recent track record in Jamaica is a very good one, with little to no infection noted among travelers. In fact, no infection noted among foreign travelers to the country. Thank you for the question.
I think we have 2 more.
What if a traveler already has such insurance coverage by buying travel insurance like emergency evacuation, etc.?
Dan?
Minister, would you like me to take that one?
That one is
Please do.
particularly tailor-made for you.
Okay. So the program is additive, and to the extent that an individual already has a mechanism in place, either a service provider or a travel insurance package that they've already purchased, our personnel and the personnel staffing this program will work with whatever insurance that individual has to deconflict that program with ours and to make sure that the delivery of service is seamless to the individual. So at the end of the day, what we are aiming for is that seamless delivery of service with respect to these types of issues.
Where and when does the fee have to be paid?
Okay, then I think that mechanism you're finalizing with some partners, and when we make the announcement next week fully of the Jamaica Care program, as it will be unfolded as an important marketing initiative and a destination assurance element within our own seamless protocols that we're putting forward, that will be announced. But we're giving the market will have enough time to be able to respond to whatever the requirements are to comply with the requirements.
This question is from Stephanie Pearson at Outside Magazine. She had a conversation with Kingsley Roberts last week, and he told her that the program was not ready to go public. She wants to know, has that obviously changed? Also, what are the exclusions to the program?
Well, as I indicated, the formal announcement of the program itself and its date of implementation will be next week. And so today is really the announcement of the agreement between Global Rescue and the Global Tourism Resilience and Crisis Management Center to effect this program of Jamaica Cares. But the actual program itself, in terms of implementation time and how the market will respond to it, will be announced later.
All right. Thank you very much, everyone. We, as I said before, we're going to prepare, we have prepared a press kit that we will circulate to the press, and through the press kit and the email communication, you'll be able to get some feedback as it relates to any additional questions that you may have as it relates to the initiative itself. So we look forward to a continued dialogue towards the launch of the program itself. Again, finally, I get to say thank you very much. Thank you, colleagues, for taking your time out today to discuss this particular initiative, and thanks to the audience and particularly the media, who we know how busy you are covering a number of initiatives. Thanks for taking the time out yourselves to participate in this initiative. I am Lloyd Waller from the Global Tourism and Resilience Crisis Management Center, located here at the Mona campus in Kingston, Jamaica. Thank you and have a fantastic day and stay safe.